Hey, Mr. W, how are you today?
How you doing?
Good, good. What brings you in?
I'm here for my medication renewal checkup.
Okay. So I was looking at your record. How are you doing with your HIV medication, and how's that going so far?
Pretty good. I've been taking them like you guys told me to. You're telling me my numbers look good, and I don't know, I'm starting to feel normal again.
Okay, great. And regarding your hepatitis C, are you taking care of that? Are you eating all right and resting and everything?
I guess. I don't really remember what I'm supposed to be doing with that, but
Okay. Well, it is important that you're, regular nutrition, sleeping well, everything like that. Those are the issues that you got to take care of. Your drug use, are you staying off the IV drugs?
Mm-hmm. Yeah, actually, I just finished up with rehab. I haven't used in a long time, and actually also just kind of broke up with my girlfriend because she was still using, and I can't really be around that right now.
And how did that go?
It went okay. I mean, with the antidepressants and everything, I've been feeling pretty good. I think it helped me get the strength to, get out of that relationship in the first place. But actually, kind of because of that kind of new problem that popped up, or rather did pop up, kind of want to ask for some Viagra. Since I've started these drugs, I've kind of had a problem with that.
So this is because of the antidepressants? Are you taking SSRI?
That's what the doctors are telling me. They kind of said it's probably a side effect of that, and it's starting to get me down a little bit.
Okay. So this is a new thing. This is, you never had erectile dysfunction before, and it wasn't related to the heart drugs,
No,
your HIV medication. Okay, now it's not a normal thing we have for patients. I've never had a patient before ask for Viagra, and this may be an issue with...
You guys are going to start this again? I mean, how many times I have to come into an ER and have people look at me funny just because I have HIV? I mean, if an old guy walked in and asked you for the same problem, he'd be given Viagra, no issues at all. It takes a lot for me to come here and trust you guys to deal with my other problems. And I don't know if I'm going to be able to deal with it if you let me down here.
All right, that's fair. I have to talk to the doctor about it to make sure that it's something that can be prescribed. It's like I said, it's not a normal thing, but I definitely understand what you're saying, that you don't want to be treated like a second-class citizen, and your disease doesn't make you less of a person as far as treatment you should receive.
Thanks, Adam. Thanks, Adam. I mean, you've always been a great nurse to me. Listen to what I have to say, and I kind of need some help to feel like a man again. A little pride while I'm out there trying to get along with my life.
And you feel like this is definitely part of you staying clean and staying with your medication.
Yeah, I mean, I'm trying to do the right thing with my life, and it'd just be really good to have something on hand so that I could go out there and not have to worry about this new thing on top of my HIV and everything else.
Okay. All right. So like I said, I got to talk. I can't prescribe, so I got to talk to the doctor. I'll relay the information, and depending upon how things go, we might have a few of us get together and talk about this. But I will. I'll see what I can do. Okay.
All right. Thanks a lot.
All right. All right. Thank you for coming today, everybody. This is Mr. W. He's a patient that's been coming to the clinic for a little while. Mr. W is 27 years old. He has a history of HIV infection, hepatitis C, and IV drug use. That said, Mr. W has attended rehab, is doing well, is right now compliant with his heart medication, as well as taking SSRIs for depression. And he feels good about the SSRIs, that they are helping him not only stay compliant with his HIV medication, but also keeping him away from the IV drugs that have, caused issues with his life. Recently, Mr. W broke up with his girlfriend because of her continued drug addiction, and unfortunately, around the same time, the SSRIs have led to erectile dysfunction. So he is here today because he's requesting Viagra. The issue being that he wants to feel like a regular 27-year-old who's able to act accordingly. I understand, though, there's some people who have issues with this, and that's why we're here to talk about this. Doctor, you are our infectious disease doctor here, correct? And you have some concerns regarding?
Yeah, I have two concerns mainly. The first concern is that is Mr. W's history of drug abuse. We have a lot of patients in this clinic that are requesting medications that are not particularly a part of their HIV treatment, and then such as painkillers and other things, and we know that they're being sold on the street, and I don't feel comfortable prescribing Viagra knowing that it has such a high street value. I'm not sure what Mr. W plans to do with it, and that's a big concern for me. My license here is on the line. Secondly, is that as a physician, I have a moral responsibility to the public, and particularly, Mr. W's partners. If we give sexual partners, if we give him this Viagra, is that going to increase the likelihood that he's going to pass on his HIV? I think, we need to be concerned about that as well. So those are my two concerns as we start off.
I do know I'm supposed to use a condom. Just want to throw that out there.
And sexual education would definitely be part of anything, but we will talk more about that. Let's try to establish what the main concerns are for everybody right now, and then move on from there. So, Mr. Schmalzbach, you are our staff pharmacist, and you also have some issues.
Yeah, these AIDS medications are very expensive. I have the responsibility for all the clinics to make sure that everyone gets their minimum medications. And we have not previously given Viagra to someone in our ID clinic. And I'm always the one who has to say no, and I think we all have a responsibility to the budget, and doctors, nurses should also be keeping an eye on the expense that they're incurring, and that's my primary concern. I don't want to have to be the one who's always saying no, but I have to when I need to.
And primarily it's because of the expense as compared to the therapeutic value of this drug?
Well, we're getting decreased funding, and the cost of the medications is only going up, and Viagra is not something that we traditionally give out in the ID clinic.
Regarding my concerns for Mr. W, I think that by denying him these drugs, we not only are potentially violating beneficence, got that one out, but also too that other patients would be treated, the issue of equality, that each patient should be treated consistently. And as we were talking about before, if an elderly patient was coming in and needed Viagra, we wouldn't question it despite their sexual history or anything like that. We would give them the medication. So in that sense, it doesn't seem fair. There's also, his ability to continue to function, and continue to feel good about himself as a person, So you know, if we do deny him these drugs, the questions of how that's going to relate to his depression and everything like that. So, but I think the biggest issue, as I see it, is equality for equality in treatment for him.
So it sounds like we have some conflicting values here. So I just want to see if I summed it up correctly and let me know if you guys, if I'm saying this right. It sounds like we have a conflict between justice, the limited resources, and the possibility of spreading HIV and Hep C, and equality, in that all people should have equal access to medications. So is it ethically justifiable for us to deny Viagra to Mr. V?
Mr. W?
All right, so Dr. Ewer, now that we sort of have a framework to build off of, can we go back and speak to your issues specifically?
Yes, I think that's a good idea. I think if I can feel comfortable with Mr. W, then maybe I could be persuaded to do this, but right now I'm just not there yet. So let's first, I want to kind of address Mr. W's past drug use. You went through rehab 3 times, which is not really a positive thing in your favor. But you are using your heart medications and SSRI now. You're very compliant, which is positive. So, you know, I just need some evidence and some assurance that you're not gonna sell this if I give it to you, because, you know, I don't have stats on it, but I know my patients are selling their meds on the street, and I'm not okay with it.
I mean, you know, yeah, I've been through rehab 3 times, but I mean, the last couple times I went through, you know, I was depressed. I mean, now I'm taking my medications, so I'm better able to deal with that a little bit better. And I mean, I was talking to Adam about this earlier too. I mean, I've cut my ties with, you know, my past history. You know, I dumped my girlfriend. You know, she kept dragging me back down, but she's gone now. I mean, you know, everything I'm doing right now is showing that I'm trying to improve myself. You know, and I have no past history of selling drugs. I mean, I was a user, but I never sold before.
And you know, there's articles too to suggest that the use of SSRIs help maintain compliance with heart medication. So, you know, you have a good framework, or you have a good series of behavior right now on the part of Mr. W.
So Adam, you're worried that if we don't give him the Viagra, then he'll stop using his SSRI in order to have his sexual function back.
Well, I mean, that is a thing. I mean, you know, when the side effect of this antidepressant, despite the fact that it does help keep him sober, after a point, you know, you can imagine if you still have these sexual urges, but you cannot physically manifest them, you know, you might get frustrated. You might stop using these things. You know,
I don't want to stop using them. I mean, I like the way I feel while I'm on them. It's just this new problem is sort of dragging me down a little bit, and I don't want to lose what I have.
And depression does there is a connection between depression and not taking your other medications. So it really could unravel a very positive trend we have going on. And the other hand too is also if you know, there is Viagra available on the street, and by denying the Viagra here, potentially, you know, Mr. W could go back to these old dealers and things like that and put himself at risk for interacting with people that might be detrimental to the development that he's making.
Yeah, I have an article here from the NIH that's a review of all the recent publications on Viagra use and sexual behavior and HIV. And it does note that 44% of people who use Viagra actually get it from a clinic and from a physician. So that means over 50% of people are getting it off the street. Of course, we don't want you to do that because it's not safe. But going to my second concern, this review also talks about that there is a correlation between Viagra use, increased sexual partners, and increased unsafe sexual behaviors, and then which leads to the significantly predictive rate of HIV infection due to those factors. And this is a big concern for me because, you know, we just have such a high rate of HIV in our community, and we need to do what we can to stop this infection. So that's a big concern for me, and I'm still worried about that.
Do you want to speak to that as far as?
I mean, you know, my mother always told me wear your raincoat. I know I'm supposed to. You know, Adam has told me about this multiple times since I've started my HIV therapy. You know, supposed to use a condom. I mean, I'm not looking to infect someone else, and Adam's been really good about teaching me about proper safe sex practices. So, I mean,
And we'll continue that education. You know, of course, that's like a important aspect of anyone who's dealing with HIV is to recognize that. But you know, we'll definitely revisit that, provided you know the Viagra is. We'll revisit regardless, but definitely with the Viagra, it becomes more important.
and you guys know I had a hard time dealing with this at first, and I could just never wish that on somebody else. I wouldn't be able to.
I know your concern is also that he will continue to infect other people if we give him this drug, but I think if we look at his compliance record now, he's compliant with his medications. What is the risk if we do not give him the Viagra? He may decide to get off of his SSRIs that are causing the side effect, and that would lead to non-compliance. I think we're at a greater risk of non-compliance if we do not give him the Viagra.
Which then leads to a higher risk of infecting another person because of higher viral load. So I think that's a good point.
My primary concern, as always, is the cost of the medication. We've got a very limited budget. I've got to make sure that all the clinics get their minimum medications. So that's my concern. And how can we address limiting the cost of this and also establishing a precedent?
I mean, I'm not looking for a lot here, guys. Just help me out.
So that's you know, if we keep the numbers down as you know, a limited monthly prescription, you know, a few pills, that no renewals, he has to come back every 30 days for a visit. We can assess again compliance with all medication, not just monitoring the Viagra, but making sure that the heart medication, SSRIs are being maintained. And that way, you know, we are doing the patient justice by treating every aspect of his well-being. I understand your concerns with expense, but again, if we can limit the amount of pills and just see its effectiveness, at least as maybe sort of a jumping off point, is that
That would help. Also, I really don't want us to be all that proactive in like pushing Viagra on our clients. Now, we do have lots and lots of free condoms in the clinic, and I think as part of, if we are going to prescribe this, we should make sure he has an ample supply of the condoms.
Right.
But I'm still not totally convinced that this is something that we can afford to do.
well, I mean, to your point of we don't want to create a precedent or whatever, there is a high prevalence, according to an article I have here by Alexander et al., erectile dysfunction, urban HIV positive population, and it talks about the prevalence is 74% amongst erectile dysfunction amongst HIV positive men, and yet only 11% are being treated for it. So it's something that is out there and right now is not necessarily being dealt with. That's an issue to consider, that this is something that we haven't been doing, but it doesn't mean that the need isn't there. It just means we maybe haven't been paying attention to the needs of this population. So it's something worth weighing as well.
I think maybe at this time we should review our clinic mission statement. And
Yes, I would like to remind you that our mission, we've always prided ourselves on treating the patients and teaching them that they can live a normal life. And I think that both Adam and Mr. W have shown that this is a quality of life issue. If we shouldn't base our resource allocation primarily on budget and reimbursement policy. We need to look at, is this a necessity? I think they've established this is definitely a quality of life issue. He's a 27-year-old male. If we were comparing him to someone else just coming off the street, a 60-year-old person with erectile dysfunction, would we question giving the Viagra?
And as far as, just to add on, as far as, even the WHO says, and this is a quote, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, this is and that's something that speaks to all of us, not just nurse, pharmacist, doctor, or anything like that. That's a big patient. That something speaks to every aspect, and so social well-being and mental well-being, I think, in part, can both be my responsibility in making sure that the patient is acting responsibly. See, just sort of
Give you a
figure out
chance.
how it goes. Yeah.
I would feel comfortable. I think you guys have given some good evidence and arguments for prescribing Mr. W the Viagra. But I would say that I would like you, Adam, as his primary nurse, to ensure that he is getting regular follow-up in case management, so we then can monitor his compliance to all his meds and see how it's going with the Viagra. And I'd also want you, Mr. W, to realize that you have a responsibility as a patient to be honest with us and to let us know how things are going. We really want you to feel comfortable here and to come to us with your needs.
Yeah, I've been putting in my hard work, and I don't have a problem coming back to do what I have to do. So, like I said, just give me a chance. I'll work with you.
Well, I still have concerns, but given our mission statement and that we're going to limit the expense of this,
Limit the expense by limiting the number that
Yes,
we're prescribing
yes.
on a regular basis and mandating that he needs to come in to get refills. There won't be automatic.
then I might be convincible.
If you can meet us in the short term and we can weigh out the consequences of it in the long term, and we can sit down and have this meeting and again in 90 days and just assess every aspect of it to see if it makes continued sense.
And I will contact Pfizer and see if there is some way that they can support a clinic with either reduced cost or financial assistance, because this does appear to be an underserved population.
Any other issues, or so at this point, are we agree that we will that in the end it's the ethical choice to give the Viagra?
I think so.
I guess so.
I think it's our duty.
I agree.
Right.
Get out there and get boning, buddy.